Hello, everyone. I'm Dr. Debra Durst, the owner of RevitalyzeMD. I am a traditionally trained MD that has a specialty in emergency medicine and spent 25 years practicing emergency medicine. And then I began my journey into aesthetics, anti-aging, and wellness 10 years ago. And since that time, I have been passionate about helping people comprehensively feel, look, and function better. I have a guest with me today, Samantha.
Hi, everyone. My name is Samantha Addis. I am the office manager at RevitalyzeMD. I work extremely closely with Dr. Durst and our patients on a daily basis. And my main goal is to make sure that your patient experience at RevitalizeMD is top notch. So, Dr. Durst, what exactly are we going to be talking about today? Since another one of my goals is to keep you on task and on schedule.
Well, today I thought we would talk about hormone replacement therapy in women.
All right. So, can you just tell me a little bit about what hormone replacement therapy means for women?
So, hormone replacement therapy is replacing hormones that are naturally declining in the body. As we age, we're going to have a hormone decline. That's inevitable. And then we want to replace those with bioidentical hormones, which mean it's identical to what your body already has made.
And I think that's something that definitely, the bioidentical part is different from what some people believe hormone replacement is, because in the past they've used different methods. So if you just want to explain how it's a little different from previous hormone methods.
So hormone replacement therapy in general just means you're replacing hormones. And so that could be done with synthetic hormones. Mm-hmm. And historically, there was a large WHO trial, and this was a long time ago, that scared a lot of people from hormone replacement therapy, including physicians, because they were using synthetic replacement, Premarin and Provera, and then there were adverse outcomes, and it scared both physicians and patients from using them. But now we use bioidentical hormones, and at RevitalizeMD, we only use bioidentical hormones, which mean we're replacing something that is identical to your body, and therefore it doesn't run the risk that you did with synthetic hormones.
Yeah, I think that's super important for women to know before they come in, because that's the biggest question I get asked when I'm speaking to them over the phone. So what symptoms should women start looking for as they start on their hormone replacement journey?
Well, I wanted to let everyone know that hormone decline is inevitable, both in men and women. And so with women, once it starts to happen, and again, it can happen in its 30s, in the 30s now because of, all the toxicities we're exposed to. We don't make hormones like we used to. But as we start to notice some differences, there could be energy decline, brain fog, weight gain is a very common complaint.
Extremely,
even yes. Body composition changes as we then, approach, 40s, 50s and beyond. And again, vaginal dryness, pain with sex, loss of libido is a huge one. And if you talk to a group of women, you're getting pretty much, the same complaints. So they need to know they're not alone. And women will actually walk around and talk to friends and meet and talk about hot flashes, which is another one, lack of sleep. But they won't walk around and talk about, more personal issues such as vaginal dryness or painful sex. And that is another common symptom that they might feel. And we definitely can do a lot to help those symptoms.
Yeah, we're definitely not scared of talking about that at the office. So what hormones exactly start declining in women as they age that you would address?
So women are a little more complex than men, only in regard to hormone replacement therapy. It's because we have more hormones in our body. So we're basically looking at in the first two to drop in a perimenopause. And again, perimenopause is usually around 45 to 55. Yeah. And so during that time frame, and it can, again, happen earlier in the modern world, but progesterone and testosterone are the first to drop. And progesterone drops, then you have trouble sleeping. We don't handle stress.
Isn't that your feel-good?
It's your feel-good hormone. Yeah. You've heard me say it a few times.
I know, multiple times. Yeah.
It's definitely your feel-good hormone. So basically, when that starts to decline, what happens? We go to the gynecologist to, has been trained and who we believe is going to address our hormone symptoms. And they want to put us on, or traditional doctors want to place people on anti-anxieties, antidepressants, and sleep medicine. When in fact, what we need is progesterone to feel good again. It helps us sleep. It helps with anxiety. It helps us handle stress better, because women, as that progesterone starts to drop, really start to get very anxious and have a short fuse, and they never had that before.
Yeah.
So it's a common complaint.
Yeah.
And then testosterone is another one, and that starts to drop about the same time as progesterone. And again, these slowly drop over time, and definitely in that perimenopause state of 45 to 55. And with testosterone, that is a brain fog, energy, weight gain, libido. And so it really makes a difference when you replace a woman's testosterone.
Yeah, we have women that are coming up to do for pellets, and they'll come in for booster testosterone shots because they know instantly when they're starting to become due for pellets. They'll be like, I need to come in to get a shot.
Yeah.
And they're like, I need pellets now.
Makes a huge difference in the quality of life of a woman. So again, libido is the first thing to drop. It's the last thing to come back. And we'll talk a little bit more about how we replace, hormones in the future, but pellets is one of them. And it's a really great way to get women feeling better. Then once we hit menopause, then estrogen starts to drop. And so when estrogen declines, then you start to get vaginal dryness and hot flashes. Although hot flashes, and I will mention, and haven't so far, night sweats can also be a progesterone. So sometimes people are erroneously placed on estrogen when it's really a progesterone issue, and they're not yet in menopause. So all of them are preventative. So estrogen, progesterone, testosterone are all preventative for brain, bone, and heart health. And so replacement is necessary when they start to drop. As our hormones start to drop, all of our diseases start as well. So not only are we feeling symptoms, but we are also getting things we didn't have before, like high blood pressure, heart disease. It will develop osteoporosis. We have brain disorders that develop, and dementia. And so it's very common for us to not only have symptoms and we seek replacement for that reason, but also long-term, it's preventative.
Yeah. So for the women listening or watching this video, what do you think would be the best first step for them to take going into hormone replacement?
So I think that they've already taken that first step, because I think they're already looking online for solutions to what they're feeling. So whether it's, why am I tired all the time? Why am I gaining weight and I'm doing the same thing I always did? Yeah. Why am I not sleeping? Why am I now having body composition changes on my leg or behind my arms or, in the bra area? Why, again, do I have no libido? My relationship is declining because of it. So they're already taking that first step. And once they're here, the next step would be is really find a provider that is a good fit for you. And so it has to be a fit both ways. So you have to find somebody, and frequently they end up going to a gynecologist or their primary doctors. And on a daily basis, I hear again, everything looked good. So they'll do general blood tests, and they do, comprehensive blood tests at times, but everything looks good. And so they're frequently told that by both their primary doctors and their gynecologists. So they end up in front of me because they want answers, and they've Googled and they know there's answers.
Yeah, they should never be ashamed of asking the questions. I think that's what holds people back a lot, is they're scared of being embarrassed, or they're just reserved about it. But we hear it all day long. We're used to it. So that's something they should never be nervous about too when they come to us as an office.
No, I think the office is awesome about, answering questions, making people feel welcome, making them feel comfortable about talking about anything that they have an issue with. And, sexual dysfunction or functional changes is frequently a complaint that women that are going through perimenopause or menopause have. And again, there's not a lot of options for them to express those. They frequently get 1 or 2 questions into a gynecologist, and that's it. And there's no solutions. And I think that conversation never happens because the gynecologists don't have the solutions. And so,
or the training that you do,
or the training. And so traditional medicine, again, I point that fact out because I am a traditional MD. And so I learned traditional medicine. And during that, I didn't learn any of this. And in fact, I'm working ER and I'm working, night shifts, and I have 3 children, and I'm doing the same thing I always did too, but now I'm tired.
Mm-hmm.
And now I, am exhausted during a shift. My mental clarity is not the same. So I was feeling it. Colleagues are feeling it. Patients were coming in with the same complaint, and we would do blood work in the ER and say everything looks fine. And they were having those same questions those same conversations with their primary doctor or their gynecologist. So therefore, I think that, again, my passion was to educate and get the message out there, and also get the treatments out there, that there is something to do about it, but you really have to learn a different way of medicine. Yeah. And so I think that the office staff has learned all of that too. And so when you guys come in, or when they come in, patients come in, you guys are great about answering questions. Oh, yeah. And they should always feel comfortable discussing anything at our office, including any kind of sexual dysfunction they might have.
100%. Yeah. We are not scared to talk about it.
No. Everybody's awesome there. Yeah. And so, but I think you have to find a fit. So those patients have to find a fit like our office, and either they're in their location, or again, travel to us, and we do a lot of telemedicine as well. But you need to find a provider that
truly
a fit
cares
for you.
About you too. That is individualized patient care, because that's something that you're super passionate about, is making sure that it's customized to each patient.
When you bring up and you bring up a great point there, because again, they'll come in looking for pellets, for instance, and so pellets we do. Some people don't want pellets. Some people don't want that insertion. I think that's the best way to get people feeling better. But again, we can use injectables or creams. And so you bring up a good point, because every single patient of ours is different. Yep. And so some people are on injectables, some people are on creams, some people are on pellets. I believe the best way to get women feeling better is on pellets. And, we can talk about that in a different segment, what that means. But I think you bring up a huge point. It's custom. Yep. It's geared towards, you need to find a provider that's a good fit for you, that's going to listen to you. But likewise, I want patients that are a good fit for our office as well, which means I need patients to be in touch with us. And so, we have frequent touch points with our office.
We're kind of clingy. We're a little clingy at our office. We like to know how you're feeling. We check in on you if you come in, we're with you the next day, making sure you're doing okay. We're very involved with patient care on that.
You guys we have multiple different ways you can communicate too, which makes it very nice. And it's probably because my staff is very hip and young, and actually much more technologically advanced than I am. So you can text our business line. You can actually, once you're a patient, text through a HIPAA compliant service called Clara. And so again, we're checking with people, but a lot of our communication is text, even when we're checking in, because people don't always want to make that phone call. So you got to find an office that works for you. I hear over and over again, as do you, they call, nobody ever gets back to them.
Yeah, we like to do it all online, because people are working, they're doing their own thing during the day, but they can just text us and we get them in. We can schedule appointments all online, so it's a very virtual friendly. If you're doing your own things, we're just texting, figuring out what days. We get it done pretty easy. We like to make it as easy as we can on the patients.
Yeah, and there's multiple staff each day getting back with patients. And so you got to find that office that's right for you. My office does a great job of it. And again, you're going to be in touch with us. You're going to get to know us probably better than you want to. And definitely in that 3 or 4 month starting period for women, we're frequently in touch with, and I tell them they're going to get to know me well, and I'm going to get to know them well, because I need to hear. It's not a one and done. If it was a one and done, you would be in traditional medicine and you would be in front of your regular doctor or your gynecologist, because they'll place you on something. Again, they may see you 6 months or 12 months, because that's what traditional medicine allows, right? And so a lot of this is not an insurance-based model, because that doesn't allow for frequent touch points with patients. And so we're checking in, we bring them in, we'll check in at 2 weeks, and adjust. A lot of adjustments can be made just with conversations. So that is important to find that provider that's going to listen to you. But I also want to find patients that are committed to feeling better and functioning better, because feeling better is one part of it. Hormones play a part in it. But when you actually have functional changes sexually, sometimes there's more regenerative local treatments that we can do. And so again, it's a comprehensive way to address it. And then once you start to feel better, sometimes you want to look better. And so we have all those services as well. So, so I think the next step is finding an office that works for you and somebody that's going to listen to you. And what we would like to do along the way with videos and with a podcast is to really educate you so that you can look for a provider that
are
fits
comfortable
for you.
Talking about the topic. It's
any topic. Yep. Any topic at all. Yep. So the best way to get this out there is to hit the like button, subscribe, hit the bell, get the notifications, share it with your friends for sure. And then please put in the comments anything else you might want to hear about, whether it's sexual, any kind of sexual function, it could be anything. Again, we are willing to talk about and plan to continue doing educational videos, whether it's about aesthetic and microneedling and, basic aesthetic procedures, or whether it is wellness. We do IV therapy at the office, if that's something you're interested in. And again, from a hormone replacement therapy, anything that you might have questions on, whether it's weight gain in perimenopause, whether it is vaginal dryness and pain with sex, and you want us to address that in a future video, then you just let us know. Yeah. And we'll do so.
All right. Thanks for listening.
Yeah, thanks for listening, guys.